Hello, my name is Professor Dr. Somshekar. I am a chairman and head of department surgical oncology, Manipal Comprehensive Cancer Center, and professor and head of department, Manipal University Department of Oncology. I am also the president elect of Association of Breast Surgeons of India. The number one cancer in India among any group is a breast cancer. There is some unfortunate thing that we have, even though we constitute 1/3 of the breast cancer in the world, but 50% of the deaths of all the cancers are from India, which means in the Western world, if a lady comes with a breast cancer, 75% of them are cured and they are alive at 10 years. But in India, 50% of them are not alive. That is the sorry state of affairs in India. So, the Association of Breast Surgeons of India is the only registered, non-profitable, totally for public, for cause, for research. It is run by a group of all the oncologists who are pioneer and specialist in breast surgeon like me, who are trained in US, UK and in India. Now, if you look back in the breast cancer state of Indian women, people are afraid that the treatment of a cancer is more dangerous and toxic and difficult than the disease. Second thing is, it is not the treatment of the breast cancer alone. They spread to something called a lymph node in the armpit. And we all know 75% of the time the cancer would have not gone. But there is no way we can know it has spread. So what is happening in India currently? We remove lymph node for everybody. And only 1/3 women are benefited, remaining accumulate all the complication. Their hand become very big, swollen like an elephant, they cannot lift the hand, they have deformities and they have difficulty to do that. We call that lymphedema. Shoulder pain, shoulder limitation. Now if you look back, the Indian women, most of the rural women take care of their husband, children, themselves, their manual laborers. How important is their arm? Imagine if they have a shoulder rigidity, pain, swollen hand, how much of quality of life differs. And breast cancer advancement in research is so much, routinely women now live and cure for 20 years, but they accumulate the complication of this treatment. In the Western world, where I was trained when I was in US, long before 20 years back, the gold standard for breast cancer treatment is something called a sentinel lymph node, where we use a special technique of gamma probe, blue dye, nuclear medicine, and know whether this cancer has gone to lymph node or not. Only if it has gone, which happens in 23%, we remove the lymph node. So we in 2011 introduced the sentinel lymph node. But if you look back currently, to do this sentinel node, you need a nuclear medicine department. How many centers in the India can afford big nuclear medicine department? How many can have a nuclear medicine doctor? How many can have this very expensive handheld gamma probe, which none of them are made in India? They all come from US or Europe. The import duty, very few, less than 30-40 centers in India has it. Imagine you have million of breast cancer, 100 of women can afford this technique. So 90% of women has over treatment. So we in the Association of Breast Surgeons of India decided, what is the use of a technology if it cannot help every human? I'll give one classical example. This seropositive for HIV, there is a cure, but the drug is so expensive, you cannot give where it is required in Africa and India. So what did Bill Gates Foundation do? They pumped in millions of money. They told in India, you find Indian solutions for Indian problems. The drugs are made by Indian company with the support of Bill Gates Foundation. These drugs to whole world which cured. Now nobody is worried about seropositive HIV. So this is the model. So we in Association of Breast Surgeons of India thought we should partner with like-minded people in India, find a technology in India for Indian women, Indian solution for Indian problem, but affordable. So in view of this, when we explored, we actually tied up with the company which produces a ICG based fluorescence handheld probe and a machine which is indigenously developed in India, Indian intellectual property code. So as a part of this, Association of Breast Surgeons of India across North, South, East, West, rural, urban, regional cancer center, government center, AIMS, Manipal, then Cochin, Tata Cancer, we wanted to do a study where we already done a pilot study which shows that this one indigenous Indian developed ICG based fluorescent device, if you use that for sentinel lymph node, is equivalent to combined blue dye and expensive nuclear medicine and the probe. So imagine which The pilot study already showed this technology is so good. It can replace this combined thing. But if we do pan India and then we publish it in international journal and adopt to Indian woman, you don't need a nuclear medicine doctor. You don't need a nuclear medicine therapy. You don't have to spend thousands and thousands on the nuclear medicine colloid. Every taluk place, every medical college, every rural area, every patient, every doctor treating breast cancer can afford this. And then once we are sure that this is going to be good, which already is very, very promising, whole world, the Western world will look at Eastern to India, and then we can dictate them what is the right way to do, better way to do with low cost. So this is an ICG based fluorescent sentinel lymph node project, which not only cures a breast cancer woman, also increases the quality of life for a woman. Imagine in a daycare, they come in the morning, no X-ray radiation, they finish a breast preserving surgery and ICG based sentinel node, evening they go home and next day they can report back to their work wherever doing. How many women will come for treatment? They'll complete the treatment and the quality of life. They not only live long, they will live and not accumulate any complication. Friends, how often in life we get a chance to change the path of cancer in India and make a difference in other people's life. Join hand with Association of Breast Surgeons of India to do this particular study with us. So we request all the philanthropic mind to liberally donate to the association to run this particular program, which will change the outcome of the breast cancer in India forever. Thank you.